Yeah, hi guys. Today's message was a hopeful one. A lot of people hopeful that the emergency response phase of this pandemic is coming to an end. It was a lot of reflection, really, over the past 2 years where nursing homes struggled. They talked about what happens next for the nursing home industry, which is struggling in many cases to hire and in many cases to make payroll. 2 years fighting an invisible enemy.
It was the scariest time of my life.
State and nursing home sector officials gathered for the first time, live and in person, inside the Duncaster retirement community in Bloomfield to reflect and celebrate.
What a success story we've had in the long-term care industry.
That's true. Connecticut mobilized the National Guard to launch and pioneer COVID recovery facilities. Connecticut nursing homes were also among the first to get vaccinated. Now the majority of residents and staff are boosted, tests are available, and visitation is open. But it wasn't always that way. Crippling PPE shortages and viral outbreaks led to 70% of all the COVID deaths in the state coming from long-term care, what the governor would say to the families who lost loved ones.
When you lost a loved one, we all lost a loved one because we're all part of the Connecticut family. And I got to make sure that despite that tragedy, we've learned from it. If we haven't, shame on us.
Now, with the virus reaching an endemic phase, the long-term care industry has reached a point of reflection, kept largely afloat by state and federal emergency funds. What happens next as census numbers continue to drop, aging facilities fall into disrepair, and Medicaid reimbursements fail to cover the cost of services?
It is a time of transformation for the long-term care industry writ large. There likely will be further consolidation and closure.
And keep in mind here that the governor has basically led the state by executive order over much of the last 2 years. So I asked the governor today, looking back, since we're reflecting, would he have done anything different? He told me one thing he would have done differently is trust but verify, not listening to the federal government when they guaranteed that a stockpile of PPE would be available at the very beginning. All right, coming up on the news at 5, we're going to be hearing the personal stories of those who were really most impacted by the saga of COVID here in the nursing homes. Of course, we're talking about the residents and the nurses inside. We're live here in Bloomfield. Matt Caron, Fox 61 News.